Hello and assalamu alaikum everyone to our regular podcast from North America Health and Wellness Club. Today I am with you, your regular host and Dr. Sadia Shanta from Vancouver, Canada, your dentist. And we have a very special guest. Oh no, she is not the special one. She is the our most regular doctor, Dr. Yafi Awal. She is a physician in medicine, and also she worked in a disability management specialist in and consumer service in Ontario. Now she is working as robotic management and development processes with private consulting company. Wow, she's a multi-talented, right? So Dr. Yafi Awal, you really have a guts to do a lot of things at a time. You're really multi-talented, I must say. And also, how are you?
Well, thank you, Dr. Sadirfin, for a nice, great introduction. I'm doing great, absolutely fine. And how about you? How are you doing?
Okay, yeah, it's a little bit busy schedule. It's a rat racing in our life. But yeah, we are fine. We are doing great. And today we are going to cover very special topics, and it's regular topics that we are going through every day, almost everybody. And what else? Any guesses? You can comment in the comment section below. We can't see any comment in the comment section. Should we wait, Dr. Yafiawal, for comment?
Not really. Yeah, we can take a minute or so and see if anybody responds. If not, we'll give them their what we are thinking for today. And just for the viewers and watchers, if in case if there is any issue with our sound system or anything technical that you find, you may also comment about that
Yeah.
and let us know so we can meanwhile we can also give you the best service for that as well. Just to let you know out there. Yeah. Go ahead,
Yeah.
Dr. Sadia.
Yeah, so we should not take more time because here time is very important, right? So we are going to talk about the heartburn or acidity. So it's a very common regular topic in almost everyone can face, especially from the age of 30 to 45 years old, because in our hectic schedule, right? So we are going to elaborate this in our discussion. We'll find solution for these problems and how can we get better in our everyday life, right? Dr. Yafi, also just I just come to you. Can you just elaborate what is heartburn or acidity is, and how can you define medically this term?
Yeah, absolutely, Dr. Sadia. Thank you so much for the introduction of the topic. So today we are going to, as you have heard, we are going to talk about the acid reflux heartburn, the most common terminology that we get to hear, or you can say acidity. Some people says I do have acidity, right? So these terms that we are just used right now, the three terms that you heard, heartburn, acidity, acid reflux, they are mostly interchangeably used. They are also medically known as like GERD, which is gastroesophageal reflux disease. Probably any of the viewers who have been with these symptoms to their physicians have probably got diagnosed maybe by this time already. So the feeling of this acid reflux or heartburn or acidity when they say, usually patients or our clients, they would come with mild burning sensation, right? You'd have like, oh, I have so much burning in my chest. That's the first most common symptoms that they complain of. Some do say I do have feeling even burning sensation up until throat, which means their acid refluxes has gone so much up into their food passageway, which we call the esophagus. So it has now come up to a part where they are swallowing, right? And some even do complain the taste sensation, which is like sour feeling. So it's like I do have burning sensation. Along with that, I do feel a little bit sour, or I'm choking something sour. So what do I do? Some people are in a severe form of a back burning feeling. So it's kind of very severe. It's not that something happening at the back, but just from the sensation, it radiates from our front. Have this, generally speaking, in GERD, gastroesophageal reflux disease, which the patient presents with heartburn or acidity is mainly a black acid secretion that occurs from our stomach. This is a natural phenomenon. We are born with this. However, in a case when our stomach remains empty for a longer duration of time, or for somebody who the stomach door, which we call as a sphincter, it's if it's not closing properly, it comes up. And that's when they do feel that uncomfortable, very much deep burning sensation, and it is difficult for them sometimes to swallow, or their taste sensation changes and they feel sour. Back to you, Dr. Sadia, if anything that you want to say.
Okay, yeah, a lot of already you said lot many things about heartburn or acidity. So you already shared a lot of symptoms, but I want to ask you if there anything, any particular symptoms, or if they can hamper the day-to-day life of the patient that they are suffering from heartburn or acidity. What do you feel?
Yes, absolutely. So, in a case, usually the first symptoms that they will come is that heartburn and sour feeling of in the taste sensation, as well as it could be that burning pain which rises upward into their throat as well, right? And then if they go to their GP, general physician, usually that's where it's the go-to place at first, and then they will be referred to, again, sorry about that, a gastroenterologist. However, the most common as along with this is it's if it is happening very frequently. For example, let's say if it's happening, in the early in the morning, they're in empty stomach, so they're suffering from this. Or if it's happening late at night when they had their dinner, but then it's a prolonged time between their dinner time and their sleep time, so that may also cause that. Some people do have, if it's lasting for a longer time, they may have unexplained weight loss or unintentional weight loss that they were not looking for, nausea, vomiting. And if it goes into a severe case, that is when it is causing a bleeding, which is goes towards ulceration. So definitely, you shouldn't be waiting for too long. If you're having that burning sensation towards your chest, you should immediately seek or talk to your general physician and take attention.
You mentioned the feeling like you the patient can feel full, and sometimes they are feeling like they want to vomit, and some patients sometimes they start vomiting too. So in that case, what they do, or what they should how fast they should consult the doctor to see that if there is any ulceration, or what kind of procedure they can do to diagnosis that
Absolutely.
type of problem. Yeah.
Right, because that's the main part, the diagnostic procedure, right? However, as you said that a patient should not be waiting when they're having heartburn till they go to the vomiting state. We don't
Yeah.
want that. That's the best part. So there is over the counter usually antacids that your GP would prescribe. Sometimes it is also not the OTC one. If they want to give a little bit, in terms of the power, the dosage adjustment, then they will give a prescribed one. However, it is always recommended if it's lasting for long, whether they have vomiting or not. Specifically, they would go for an endoscopy, right? The upper GI endoscopy is the best suited one. Sometimes they do prefer an ultrasound. However, the endoscopy is the best treatable one. Though it is a little bit invasive procedure, it may take some time, but that is the best diagnostic criteria that they would want to eliminate their differential diagnosis is that the patient is not suffering from ulcer, or it hasn't gone to any other, upper gastrointestinal diseases, and it's just remaining to the GERD, the acid reflux, or any other gastritis or peptic ulcer. So upper GI endoscopy is the one root call that they would go for definitely.
So just you just mentioned the word endoscopy, right? So and I also know that some patients or some people, they're always scared of endoscopy term, because some patients have don't that kind of good experience with endoscopy, and they
Mhm.
like there are some lacerations in the GI tract, and they feel pain, and they maybe sometimes don't want to eat properly for sometimes. That's why some patients scared of. So in that case, if there any uninvasive procedure you may mention, or also in North America it may took long time to wait for this kind of appointments to get. So is there any other investigation, or if they wish they don't want to do the endoscopy initially, so what you will suggest them in that kind of patient?
That's right, Dr. Sadia. So initially, when the patient comes or presents with these complaints and it's hampering their day-to-day life, it starts with the antacids first, with the OTC or with the prescribed one. Either is fine to calm their or soothe their acid first, right? Because the patient needs to be able to be in their comfort zone until they get an appointment or until they get diagnosed fully or to eliminate those diseases. Now, along with it, definitely there are some lifestyle modifications required because these diseases, for example, even if our previous one, if we go back to like asthma, acid reflux, acidity, heartburn, they are very much connected with our day-to-day life. And your lifestyle, your routine, your food habits, these impacts it very much. So within those 3 months, 6 weeks time period, the best option is like for them eliminating common trigger foods such as like citrus fruits, tomato-based option, garlic, chocolate, which can help, as well as other common culprits that we can discuss as well is high fat, spicy, and fried foods. So these has to be avoided. One. Then there are some beverages that they can avoid as well, like coffee, tea, especially in empty stomach. They shouldn't be taking any coffee or tea. They're having heartburn, right? It really aggravates it when you're taking your antacid because it's not going to work if you're not modifying this and you're only taking medications, and you will be just keep going back and forth to your walk-in clinic or to your GP, and nothing else is going to happen much. So that is a very thing. If for those who are smokers, they must quit smoking or at least try to reduce it and not have it in empty stomach. Definitely no in the early morning or before going to bedtime to avoid that. Apart from it, lifestyle modification like yoga, stretches, and also they can take some supplements like vitamin B supplements for better absorption, digestive enzymes that can help them better absorption for their food, and there is no acid accumulation. And these can actually help while they're in the waiting period. Even some people actually, if they're managing these along with their medications, what happens is they come into a state by the time that they go for the investigation, they are almost treated, they're cured, right? They don't really have the symptoms anymore. However, the diagnostic test is done just to make sure that there is no upper GI bleeding or ulceration or any other upper gastrointestinal diseases happening at the same time with the heartburn, right? So just to diagnose those, they still go for it. However, by that time, if they maintain all of these things, they can actually reduce it to a level that they can live a normal life, which is very impactful. Back to you, Dr. Sadia.
Okay, you just give a lot of information, and I think a lot of patients are those are suffering from this kind of problem. They will benefited so many times with this. Mentioning of the citrus foods, can you just mention what kind of citrus food they should avoid in this suffering from heartburn or acid reflux? I must want to share that tomato, the one food that some people may suffer from heartburn or acidity, but they don't know tomato can cause acidity or acid reflux. So, can you share some citrus foods or different kind of foods that can affect uh, to this heartburn and acidity or
Yes.
exaggerate?
Sure, Dr. Sadia. So basically, you do not want to take anything that is more acidic to create more acidity. Let's just put it in
Mhm.
that way, the calculations, right? It's a very easy
Yeah.
calculation. For example, if you talk about pineapple, if you talk about orange, if you talk about, as you said, tomato based, which I mentioned before, onions, garlic, chocolates, and any kind of citrus fruits, which includes a sour test. Why? They releases acid as well. Now, there is a difference between if you were taking those fruits in a fuller stomach or
Mm.
if you're taking it in an empty stomach, right?
Mm.
That's when you're triggering it.
Yeah.
So whenever you're in an empty stomach for a longer time, it's just not that it is early in the morning. However, if it's during or between during your daytime, between your meal time, but for example, if you have been in your empty stomach for 2 3 hours, now you're hungry, you're having acidity, but you just chew on a piece of an orange, right? Or you
Yeah.
just swallow down a piece of a pineapple. So that's gonna trigger it because you're taking something more acidic, or you're taking a black coffee. So
Mm.
black coffee is still in kind of, it's getting research, it's like a controversial thing. For some people it is not causing much heartburn, whereas some
Yeah.
people get severe heartburn to it, they're very sensitive to it. So
Yeah.
you do also have to notice kind of based on your body, your type, if it is helping you or if it is triggering you. If after taking any of these fruits or tea, coffee, you feel bad, it's worse, that means you gotta stop it. You need to understand that this is actually triggering it and you shouldn't be taking. So all of these fruits that I have mentioned, apple cider vinegar, or tomato based, or pineapple, or orange, any of those which has sour and acidic release fruits, um, shouldn't be taken in empty stomach at all. Never to take tea or coffee, as I have mentioned, in early morning in empty stomach, or even during the day between meals, but you're an empty stomach for a very long time. So you must avoid or eliminate all of this from your diet, from your lifestyle. You can have them, but definitely you should have some other soothing, more calm food or a meal, proper portion of a meal. And maybe after 15 minutes, you want to enjoy these fruits, go ahead, that will help you, right? So you need to balance it out like that.
Okay, thank you so much. It's a lot of information at a time. Can we take some question from the audience? Because I have got two. I think one brother is asking. Uh, he have a question that is there any direct connection to smoking with heartburn? That smoking causes heartburn. Is there any direct connection?
Yes. So if you are asking for yes, no answer, yes, the mechanism medically it's gonna go up and above the head, I would say. But however, let me explain a little bit. So smoking and alcohol, it does affect or it does directly trigger your body to release more acid, especially if you're in empty stomach or even if you're not. For example, for smokers or those who takes alcohol or if they have a habit, what happens is when they are stressed, that's when they are more prone towards going for a smoke, right? Let me get one stick. Let me get a glass of drink. So what happens is stress induces GERD itself. Stress induces acidity itself. There's a huge connection between stress and releasing your stomach more acid and developing heartburn. So when you go for a smoke, it triggers it more. And then on top, if you're in empty stomach, it takes away your appetite from you, so you don't actually eat much and you go one after one, then it's releasing more acidity and which is coming upwards and upwards now because you're not drinking or eating anything else. So definitely smoking and alcohol has to be eliminated, if not initially, because it does take some time for these smokers or for those who do have a history of drinking. So they have to kind of balance it out and reduce it to a moderate amount or to an amount which is tolerable for their body, which does not trigger their acidity. So it does have a direct connection and it needs to be always monitored and as much as possible reduced to a level of 0 to mild.
Okay, thank you. So here we can see that this empty stomach and acid food, these two has the real direct connection with the acid reflux and heartburn, right? So we can take another question from one of sister. She's asking that if there is any differentiation between the normal heartburn and its serious condition, how can she know that his condition is serious or normal?
Correct. That's a great question, actually. Thank you, whoever has asked that question. So, initially, when you have just a burning sensation into
Yeah.
your upper chest area, where I'm touching, like just your upper chest area, which means you can just say that, okay, it's just heartburn or acidity, right? Where sometimes they just go to a over the counter, even they discuss with the pharmacist, and if it is okay, they will, tell you something that these are the ones you can try this. Nexum, for example, or something else. And if it is not, they will just tell you, no, go to your GP. Some pharmacists are okay to tell you or show it to you. Some pharmacists are not okay. So they will just tell you, go to your GP, and your GP will just give simple stuff and you should be fine. Now, it's come to a point, probably you have been taking those medications, your PPI proton pump inhibitor or H2 receptor blocker, anything that your physician has given to reduce this acid production. However, it is in a situation that you cannot function into your normal day-to-day life. What do I mean by that? You cannot have your uh, proper 4 times meal. You're vomiting, right? When you go to eat your meal, you feel you're full. You have loss of appetite. You are having unintentional weight loss for a longer time. And then nausea leading to vomiting. Then it comes to a severe state where that with your vomiting, you're seeing blood. That is really a red flag, and you should definitely reach out to your family physician as soon as possible. Because in North America, without your family physician, you cannot go to your gastroenterologist. So as the sooner you go to your GP, the sooner your appointment will be going into the portal to your gastroenterologist. So these are very valuable, that if you have vomiting issues, if you're having loss of appetite, you're not able to have your meals properly, at least the 4 times meal or 3 times meal, whichever you're habituated to, you're feeling all the time full, whereas you haven't eaten anything, right? So that is a very triggering factor, that it has gone to stage 1 to stage 2. Or if you're actually vomiting right after your meal, okay? And with the vomiting, definitely if there is even a single drop of blood that you see, or reddish or sour test comes in, right away, you should know that this is a red flag. I must see a walk-in or a doctor.
Yeah, of course, Dr. Yafi, you are just sharing a lot of information that the patient must know. Now we should discuss about some treatment outline options for acid reflux. So in this case, what kind of treatment the doctor can suggest, or as the doctor point of view, you can suggest, just share it with us.
So if we come into the treatment options with acidity, heartburn, or just if it is GERD, gastroesophageal reflux diseases, it's very plain and simple treatment outline initially, because initially, as I said, like it starts with some mild symptoms. Then if there is bleeding or other tendency, it goes towards surgical, which is a totally different scenario. Now, if we come to our day-to-day management of for this, when you're having heartburn, as I said, like antacids are the best. They give the OTC one as well as the prescribed ones, which will reduce it within 4 to 6 weeks time for sure. Along with it, there is lifestyle management, which are required. And definitely you should have a proper dietary lifestyle to be followed every single day. No tea, coffee, at least for the first 3 months, to feel yourself better for a proper functioning day. Sometimes there are some H2 receptor blockers are given, which are also a different type of medications, which are prescribed by your physicians, right? Now, there are, as I said, like your physician would list down all the food that you are supposed to avoid. And along with it, there are always home remedies that you need to follow.
Oh yeah, of course. One sister is asking a question. Ria Ulbers, you can stay with us, sister. You will get to know all of your questions answered by the end of the session, I think. So now we will move forward and we'll ask Dr. Yafi Awal. So, is there any home remedies you can suggest? So that the patient can feel better when they are waiting for treatment plans, or they want to try in the home. You can share with us that too.
Sure. So I will go in short, not elaborating much in details. However, the tips and tricks, the strategies that are definitely to be followed, which are natural remedies, what we call, or home remedies for heartburn, right? So if we are talking about home remedies for heartburn, the first thing that you go is keeping a food journal. Your general physician usually will always take you to have a journal, a diary, to have your food, what food intakes are you having. This is to be done because your physician wants to see if you can follow it properly throughout the daytime, right? So a food journal and avoiding all the triggering foods, that is causing your heartburn. So certain foods and drinks that can trigger and reflux the heartburn, as well as reducing lower, the lower pressure for the esophagus. So that's what they want to do. Then there is also avoid lying flat right after eating. See, because when you lie flat, your stomach acids, it's more prone towards upward. So you want to avoid that. So they will definitely suggest, or it is a best remedy, or you can say a lifestyle change advice to be followed, that avoid lying flat right after eating. Resist the urge to overeat or eating very quickly, right? Because when you overeat, that is also pressurizing. So you do not want to overeat or eat very quickly. You want to slowly eat, so it is you can have a better absorption rate. And then you can, if you are overweight, so there will be unintentional weight loss. However, if you're overweight or if you're underweight, you should maintain your weight. That is one more thing. Now, alongside with this, you have to always adjust. Like sometimes people, if they're wearing too much tight clothes, that also gives them some uncomfortable situation. So you do want to try for some loose fitting clothing. As I said, smoking, alcohol, these are to be avoided. Digestive enzymes and supplements can actually help aid in this process. So you may want to add some supplements like vitamin B complex that really helps in absorption, as well as some digestive enzymes to reduce the acid secretion. For the digestive enzymes, it must be organic or plant based, just to make sure that it doesn't have any acidic, triggering factor along with it, because you do not want to induce it. You rather want to reduce it. So these are the things to be definitely followed. Also, in the early morning, if you can have a turmeric drink with honey, that will really help. In a lukewarm water, you can mix 1 teaspoon of honey with an organic. You must make sure that it's an organic honey powder. Sorry about that. The turmeric powder or the turmeric tablet formulation, whichever you're comfortable with, you can use that. This organic turmeric actually helps in many diseases. So this is not just going to help with your heartburn. It's going to actually purify your whole gut system, your GI system, and that really helps to build up your immunity. So you can follow this one for anything that you're suffering from, and this really helps.
Okay, it's a really informative session. Actually, I want to ask you one question. So you are talking about supplements like vitamin B complex, digestive enzymes, turmeric. How you want to suggest that there are so many in the markets, right? So the organic one, or which one should the one patient can take from the can they directly go to the market and buy any one of them, or like how can do you have any consultation through online, or as we are running our North America Health and Wellness Club? So how if any patient want to just deal with us with their problem, can you give them suggestion, or can we give them any consultation, and if there is any, which days, and how they communicate with us? Can you share that too?
Sure, Dr. Sadia. So focusing on that, as we have mentioned that as you can see in our broadcast system as well, that there is no prescribed medications to be given. However, as you're talking about supplements, there are multiple brands. It is true. We want to make sure that it's organic or it's plant-based, right? So in that case, there is Nutrilite, we can mention about it, or there is other brands that, which are similar into the quality for this. You can definitely go for that. So if anybody has questions about this, they can reach out to you, to us, or in the comment section, and they can know about the digestive enzymes or vitamin B complex, and which can help their gut health, or their which can help into reducing their acidity, alongside with the medications that they are taking, alongside with the lifestyle modifications which are required. Even we can also list down for them the lifestyle modifications which are required based on their history, based on their symptoms, because everyone has a different schedule, right?
Yeah.
So with that, they can go for this supplements intake for the first 3 months, along with the medications that they're receiving. So it helps more and it relieves their symptoms faster. That is what we want. That is the always the target, that people or the patients, they always feel comfortable.
Thank you so much. I think we are almost near the end of the session. So I just want to ask you one question, and then we'll go a little further. So
Mhm.
I know you have almost explained everything very clearly. What about some red flag to the viewers? You want to, if the patient need to seek the medical attention, so what will be that situation? Uh, in they can take the medical attention, or they need to go to the GP or to the emergency, or in the hospital.
Okay, Dr. Sadia. So thank you for the question. It actually, I think we have almost covered this with a different question from a viewer. However, to reiterate or re-emphasize on this, as I have mentioned, if it is happening for a longer time, for example, if you are already suffering from heartburn or chest burning or back burning for more than 2, 3 months, and there has been no reduction in your symptoms, there has been no relief in your symptoms. Along with it, you're having nausea. You have developed vomiting. You can't eat anymore. You're having unintentional weight loss. These are all symptoms that is giving a hint if there has been any ulcer developed, right? We don't want that. And then thirdly, it comes into a role if you have any kind of bleeding. So it is
Mm,
very important that you rush to the emergency. You do not wait for any kind of physician appointment, and you directly get it diagnosed. And as soon as possible, you get the treatment as well, because you do not want any kind of severe medical condition at this point, from ulceration to upper GI bleeding, which will require for going for a surgery. So to avoid that, do not wait till that time. As soon as you have a burning sensation, uncomfortable feeling, whether in your chest or in your back or in the throat, and you're having sour taste sensation, you should seek medical attention. You do not want to wait until you go to a state of unintentional weight loss or any kind of vomiting after taking a meal. You do not want to wait for that.
yeah, yeah, of course, yeah. So we are taking one or two questions because we are almost ending up the session. So one sister is
Sure.
asking, how can she manage her heartburn or acidity during pregnancy time?
Absolutely. So during pregnancy, number one is your daily routine, right? You do have to maintain a very good lifestyle. Pregnancy is a very pleasurable time in for the women. It's a very blessing time. So I would say, alongside with the vitamins, everything that has been prescribed, the folic acid, your nutritional supplements that you are taking, along with it, you need to maintain a food journal very much. So your time has to be very specific. Let me give you an example for pregnancy people, like for the women, especially when they are in this stage of their life. It's a stressful sometimes. All are not same. Some can manage very well, some can't. So based on your workload, if you're working, if your morning starts from 6 o'clock and till 9 o'clock, you're in empty stomach,
Mm,
that is not going to work for you. Even if it works for a general person, it will not work for you. So as soon as you wake up early in the morning, you got to take at least a glass of warm water with honey and turmeric. If you can't do that, just go with 2 glasses of warm water. That will reduce your acid reflux a lot. Number one. Number two, you need to have small, frequent meals. If you were having in your non-pregnant state, let's say 3 meals a day or 4 meals a day, right now you can divide up the same quantity. You don't need to have doubling of food. No, that's a wrong conception. You will have the same quantity of food. That is absolutely fine. However, you need to have frequent small meals so you're not in empty stomach. Because what happens, sometimes the pregnancy hormones, everyone's body does not react the same. They also causes some stress, which causes the aggravates or causes the acid secretion. So you want to reduce that. So you need to have your fuller stomach, always something in your stomach. For example, if you're in a meeting or if you're missing out sometime, try to take at least a glass of a water or a cool milk. That will help you as well to reduce your stomach. But make sure it's cool milk, as well as it's the low fat milk, not a full cream milk or not warm milk, because you don't want to aggravate. That's the opposite thing it's going to do. So these are some, as I have mentioned, like these are some food and lifestyle changes that you need to follow. Exercise, yoga, or stretch will also help because that reduces the stress And when you are reducing your stress, it will automatically reduce your acid secretion. So lifestyle managing is very challenging during the time of pregnancy. However, it is very important. And definitely, along with your nutritional supplements, you need to make sure that you are on vitamin B properly, the B complex or enzymes if you need to, which should be organic or plant-based during the time of pregnancy to make sure you have better absorption, right? Better emptying of your stomach. Number most important, sometimes in pregnancy, people do suffer from constipation. You need
Yeah.
to avoid that as well, which is very important. So if you can't, if you're not having a good, emptying of your gut, you can go with some fiber. You can go with some omega to make sure that you have a good, you don't suffer from constipation. You can use papaya with milk or papaya milk juice together to get a better relief. So these all will really help for a pregnant stages, to reduce your heartburn. 6 times a meal is a must or a go-to thing that they can always have. They can have some cookies, crackers with them. They can have a bottle of water with them to help them support during these stages. I hope this helps. And if you have more questions, you can definitely reach out to us.
Yeah, a lot of information, and I want to add something more because we are a mom. We also have that feeling too at the stage of when we are pregnant or something, some thing like that. Because this in situation in pregnancy, there is a hormonal changes, right? So every mom or every pregnant woman is unique. So it's react differently with every one's body. So sometimes it's like that Dr. Yafim already mentioned that you need to just separate the meals time, just take in a small portion. If you are having 3 times in a normal in your normal body, but when you are pregnant you can divide into a 6 time, and you can also put your stomach in empty stages, right? So if you are waking up in 6 and you are eating your meal at 9, it's a huge time. There is a vacant your stomach and you are feeling full, and when you take something, it you will going to feel full. It's the normal phenomena. And after you if you try the whole day, then it will take the same situation. You're feeling full will not going away because there is another person was just going in your body, inside your body. So this you have to change your lifestyle. And also there one thing that Dr. Yafi mentioned, that constipation. So some person have the iron deficiency in these stages, sometimes because we need to take the prenatal multivitamins or iron supplements, sometimes need we IV iron too. So in that cases constipation is normal. So you need to take the fibrous fruit, like Dr. Yafi mentioned, that is a papaya or any kind of fruits and vegetables, leafy green vegetables. And also one we just share this the fiber that we used with different kind of seeds like soya seeds, pumpkin seeds, and nuts also very. And I must mention dates and raisins. These foods are very important in pregnancy. It will increase your iron level, and also these kind of foods are fibrous too. So yeah, a lot of information, informative session, and we got a lot of information from Dr. Yafi. Can we take one or two more questions?
Yes, sure.
Once brother is asking that how stress connected to heartburn and acidity.
All right. So
How
that's a great
frequent it
question.
is? Like one is so, like we all are stressful, right? So if some patient have heartburn or acidity and he is in a lot of stressful condition, so how can he just modify his lifestyle or take relief from that stress like this?
Yeah, I think the question that you're reflecting upon is how does the stress or anxiety impact
Yeah,
the frequency and severity of the acidity
yeah,
and heartburn episodes? Okay, thank you for the question to the viewers. So, firstly, stress, anxiety. The main problem is not always that your stomach is secreting the acid because you're in empty stomach and it's only coming from the stomach, right? Our body, whole body is connected. Let's just put it that way. So, what happens when you're anxious? Your the nervous system gets stimulated. There's sympathetic, there is parasympathetic, which are the medical terminologies. However, so when it triggers it in a simple plain word, what happens? Your whole body's hormonal circulation changes. In stress and anxiety, we do not have the normal hormones, the normal releases that we generally have when we are in a calm state. And those are the triggering factor that is impacting your stomach or pushing your stomach in some cases, not for everyone. I will just pause and connect some dots here. For example, some people run away from when they're scared, right? So that's their response. Some people says, I will stand here and I will fight back, right? That's your mental. That is a by birth thing. We cannot change it. It depends on personality to personality and also your exposure to your life. Why I brought this example here is because similarly, your body, when it releases all those different hormones, all those different neurochemicals, when you are in stress and anxiety, every individual's body is going to react differently. Some people loses their appetite, some have more appetite, they gain weight. Some loses appetite, so they lose weight, right? There's no intentional weight loss, however unintentionally over the time period they lose weight. So what is happening here is all of these neurochemical changes is triggering your stomach to release more acid secretion or refluxing it because of your wing sphincter, right? Now, when this happens, this is when, due to the stress and the anxiety, if you're feeling more anxious or if you have anxiety disorder or you're taking too much stress, for a few individuals who are very sensitive, they may have more frequent symptoms compared to an individual who is not in stress. So the normal individual may have, let's say, one episode of heartburn just early in the morning or at 11 a.m., or maybe twice a day, thrice a day, right? Whereas this person is having at a point where is stressed for a very long time, for 3, 4 hours, and they're really suffering. There are patients who cannot get out of the bed because of heartburn, chest burning, or back burning. They may have to take off or leave from their work for 3, 4 hours, for half a day, or for a day. They want to request for a leave day, right? So especially this happens in students' life more because it's very hard, difficult to follow the
Mhm.
routines if they're especially staying in the university dormitory area, and that they're also very highly stressed because they want to complete all of their tasks. Or if you're in a position where you really don't have any time to focus on yourself. So this is where, as you have asked, like how does it impact and what is the frequency? So this is the reason, because of the neurochemical changes, because of the hormonal changes, right at that moment, because of your stress and your anxiety, your brain is releasing something different to your body, and your body goes to a whole different circulatory system, right? Full systemic responses are now different. So it releases more acid, and that's when you're having more frequent symptoms of your acid reflux compared to a normal individual. So in this case, more than even lifestyle management, you need to focus on the lifestyle management for stress and anxiety management at first, alongside with your food habits and your medications. This is for sure. You can even take some stress relief. Probiotics really helps. Probiotics helps even for normal individual as well. So along with probiotics, you can take some stress relief supplements if you're okay with it. You can exclude for those first 3 months maybe the vitamin B, and you can go for the stress relief first because that is your triggering factor, right? So these are the helpful tips that you can follow: stress relief, probiotics, supplements to reduce your anxiety, stress. If you're on medications prescribed, that is absolutely fine. You need to follow that. Along with it, if you want to have supportive management, definitely follow this.
I want to ask you a little question. That
Mhm.
is, as we know, that sleep disturbance or less sleep have or lack of sleep, because we are all stressed, and we some people are working in the night time too, so they definitely have the sleep disturbance or lack of sleep. So we know the sleep lack of sleep have direct connection with heartburn or acidity, right? In that case, some people sometimes take sedatives, or some people take antidepressants to get relief from that. So how can you just share to our viewers that this kind of situation have connection with acidity or heartburn problems, and how can they resolve these issues?
Correct,
Sleep
Dr. Sadia.
problems
It's a great.
and with antidepressants and sedatives, I
Sure,
guess.
Dr. Sadia. Great question. So, focusing into that, you have talked about sleep pattern, which is a very good point. So, everybody needs to sleep at least for 6 to 8 hours. There are variations. Some may require a little more, some may require a little less. Some may go for 5 hours. They're okay. They're functioning well.
Mm.
However, 6 to 8 hours is the recommended one, and definitely with all the research based, it has been revealed that they do respond really well and they are free of mostly all the diseases. Now, if someone has night shift, why we are told, because our biological clock, our circadian rhythm, it releases those hormones for us as soon as it's sunset for a better absorption of our food. That's why we are supposed to have our early dinner. Like by 6 to 7 p.m., you're supposed to finish your dinner because you want the food to be absorbed before you go to bed. So when you're not sleeping at night, right, it is totally giving your biological clock, your circadian rhythm, a different signal that this person is not sleeping. Now, whatever hormones, the chemicals that were supposed to be released inside your body, they are now totally fluctuating. They're in a different state, which causes slowing of your absorption, the food absorption, and all other symptoms as well, alongside, which is why they suffer more from stress, anxiety, those who are working in night shift, or they have, some other health disorder as well. But focusing into the acid reflux or heartburn part, there's a delay in their absorption, or there's a delay in their food to be emptying from the stomach. So because of this, it is staying into your stomach for a longer time, and then the next day that is also happens that you're in a fuller stomach, you don't feel like to eat. However, the food that you actually had did not get properly broken down by your body, so you don't now have proper nutrition, neither you have a proper emptying of your stomach. And those, the proper acid after our food, we have some natural mechanism where the acid comes in, the acid helps your food to get digested, but that didn't happen properly as well. So this all together accumulates inside your stomach and causes you more to have your symptoms like heartburn and this acidity, the acidic symptoms that you come up with. And then I think you were focusing on that antidepressants or sleep sedatives. So if your time patterns are different, but you have different schedules, like one day night, one day day, so you can definitely try with the sleep hormones, the regular ones from the over the counter, but you do not want to take apart from the prescribed antidepressant from any other source. Antidepressants are only given with diagnosed criteria. Okay, so unless you have been diagnosed, you shouldn't be taking antidepressant. Now, if you are taking antidepressant and you are seeing that because of your antidepressant, you now have heartburn or acidity, you can definitely go for lifestyle management, yoga, stretch, taking some probiotics. Probiotics is very helpful in this case. Turmeric drink is very helpful in this case. Vitamin B complex is very helpful in this case. Along with it, definitely let your physician know so they can prescribe some H2 blockers or proton pump inhibitors, the basic medications, the general medications, treatment options with your antidepressants, so you do not have the acid reflux. Because right now, for example, NSAID, non-steroidal anti-inflammatory drugs, which are painkillers, they also sometimes causes some heartburn and acid. So these are just specific trigger factors. Any medications which you are taking, it's just for that duration of time that you're having. So you just need to, since you have to take those medications along with it, you need to take your antacids or your over-the-counter medications for your acid reflux so you feel better and that medicine does not trigger your stomach acidity. And you can go for lifestyle management.
Wow, what an excellent and informative session. We almost 1 hour. here in our live session, and we took so many questions from the audience too, and you covered everything: what acid reflux is, when we should go to the doctor, with invasive or non-invasive procedure we can investigate it to know what is acid reflux, and what is heartburn, and what is everything. And also you mentioned supplements that are organic and less side effects, and also treatment procedure, over the counter medicines, and how can we change our lifestyles, our home remedies, everything. You covered everything. I think there question people and patients and people's questions are coming and coming and coming, but we are almost end of our session. We're taking so much time of yours, and we are going to end of the session. So thank you, the patients and audience, for being with us and just listening us for this long
Yes.
time. We are going to end up the session now. And from North America Health and Wellness Club, if you want to contact with us, you can contact in the number below in WhatsApp, or you can text us with your problems. We can give you a solution. I'm Dr. Sadia Princhanda and Dr. Yafi Awal. We are here. We can listen your problems, and we can help out you from your problems. So we will not take too much time today. We are going to end of the session. Thank you so much. Goodbye, everyone.